Hi, my name is Ellis Michaels, and I was diagnosed with Behcet's disease in 1997 at the age of 16. In this video, I'm going to tell you a little bit about Behcet's disease and mental illness. Now, let's start with me. I um, I went to school for psychology. I got a bachelor's of science in psychology with a special concentration in medical psychology, and then I went to grad school for clinical psychology. After school, and I worked my way through school as an EMT, and then after the school, I worked in the mental health field for 15 years. I worked primarily with young adults and primarily with males, but I did work with some young women as well, and I have a lot of experience working with everything from autism to anxiety disorders, personality disorders, psychotic disorders, mood disorders, everything. I saw it all, except MR. I didn't work with MR populations, but everything short of that, I saw it all. And but what qualifies me even more than any of the school or the work experience is the fact that I've struggled with a lot of mental illnesses myself, all throughout my teens and 20s, directly related to Behcet's. So I feel like I kind of know what I'm talking about as well as anybody does. So let's just jump right into it. So it's no secret that Behcet's disease fucking sucks. It's painful. It's unpredictable. It's awful. It is awful. And it's no secret that mental illness is more common in people with chronic illnesses. That's a big risk factor for mental illnesses. Others include like family history, stressful life events, lack of social support, childhood abuse, stuff like that. But yeah, mental illness is very common in Behcet's disease, and there's two types of mental illnesses that are particularly pervasive, I guess you could say, in people with Behcet's. And the first one is mood disorders, specifically depression. Now, I think maybe not all, but most of us that have been diagnosed with Behcet's have experienced some pretty intense depression at times. In general, on any given year, depression affects about 10% of the general population. But for people with chronic illnesses, it's somewhere between 20 and 25%. So it's more than double. What is depression? Well, obviously, depressed mood, you just kind of feel down and sad. Lack of pleasure in things, anhedonia, that means lack of pleasure, just things that you normally like doing, like listening to music just doesn't sound good, or food doesn't taste good, whatever. Maybe your thinking processes are a little bit slowed down. You're tired. Maybe you're sleeping more than usual. Hypersomnia, or maybe you're sleeping less than usual. Insomnia. Both can be possible with depression. And then there's weight gain, weight loss. Some people gain weight when they're depressed. Some people lose weight when they're depressed. Feelings of worthlessness, thoughts of suicide. These are all symptoms of depression. Now, I was suicidal for years. All throughout my teens, I was just so fucking miserable. I was in pain all the time. I was lonely. I was anxious. It was awful. I was severely depressed for over a decade. And doctors threw all kinds of antidepressants at me. All the serotonergic ones, Prozacs, all that shit. Didn't do nothing. Just made, I had got some side effects, but no depression relief. But eventually eventually down the road things started to get better. But all throughout my teens and early 20s, I was depressed as hell. And I was also super anxious, which leads me to the next type of disorders that are common in people with Behcet's, anxiety disorders. Nearly 20% of adults in any given year have an anxiety disorder. And there's different types. There's generalized anxiety disorder, which you just kind of worry about all kinds of shit. Social anxiety, where you worry specifically about social interactions and stuff like that. Panic disorder, where you have like your flight or flight, like you have an adrenal response when it's really not, for no reason. Sometimes flight or fight is good. If a fucking lion comes out of nowhere and starts chasing you, it's good to be able to like quickly react. But when you're just sitting at home watching TV and your heart starts beating 200 beats per minute, that's not good. So panic disorder is just having panic attacks. What else? Agoraphobia. That one's less common, but it's still seen some people with Behcet's. Agoraphobia is a fear of leaving your home. You don't like to go out. You just like to stay in. And then there's all kinds of other phobias and stuff like that. And OCD too kind of lumps in with that. But in general, we're talking about like generalized anxiety disorder and social anxiety. When it comes to Behcet's, I know it caused me a lot of social anxiety, especially in high school. I had these big golf ball sized cysts on my face, and I was just, there was just so many things. And then the ulcers in my mouth, I couldn't talk. It hurt to talk. I walked weird because my balls were covered in sore. It was just, I was anxious. I was a mess. I was so anxious. So anxiety is very common, especially in the early stages of the disease, because you don't know what's happening. You're anxious because you don't know what's coming. Is this gonna fuck my entire life up? Is this gonna go away? Is this gonna get worse? Is it gonna get better? There's a lot going on there. And anxiety is normal. It's good in certain levels, but when it starts to interfere with your life, when you're worrying about stuff that you really shouldn't be worrying about stuff you have absolutely no control over, it starts messing with your life, then it can become a problem. Now, a 2019 study found that 40.6% of Behcet's patients were diagnosed with depression and 43.2% with anxiety. So that's almost half of us. Half of us are diagnosed with depression. Almost half of us are diagnosed with anxiety. So you're not alone. You that might make you feel even more alone than just having Behcet's. But if anything, it makes you more normal. Because being depressed and anxious after getting diagnosed with a lifelong painful chronic illness is kind of the right response in some ways. But anyway, so the next class of disorders I'll mention is substance abuse disorders. This is another one I fell into thanks to the medical profession. Although, to be fair, at the time I was in so much pain, I needed the painkillers. But doctors in the 90s used to throw painkillers at me like crazy, and I ended up getting hooked on them. It was a big thing. But pain, depression, anxiety, these things are all like linked to addictive disorders. So it's not surprising that a lot of people with Behcet's develop substance use disorders, whether it's to illicit substances or painkillers or anxiety pills or whatever. Alcohol, it's pretty common. In fact, about 1/3 of chronic pain patients also have a substance abuse disorder. And again, no surprises there. You're in pain all the time. You're gonna want to do whatever it takes to get rid of that pain. I know I certainly, I did a lot of dumb shit when I was in my teens, but it was all just in the name of trying to not be in pain, not feel miserable, and just trying to be a normal fucking person for a few hours by any means necessary. There are other disorders that can be related to Behcet's, some sexual dysfunction disorders, stuff like that. And people with Behcet's aren't immune to other mental illnesses, things like, I hate to call autism a mental illness. I hate to call any of these things mental illnesses. That's a whole another rabbit hole I'm not going to go down. But people with Behcet's can have autism. They can have schizophrenia. They can have bipolar disorder. They can have all the personality disorder. They can have all of these things. So while things like depression, anxiety, substance abuse, these are more common in people with Behcet's. Behcet's, people with Behcet's can develop any mental illness. So that's just something to be aware of. So I just wanted to give you an idea of the different types of mental illnesses that people with Behcet's typically have to deal with. Now, just because you have Behcet's doesn't mean you'll necessarily become depressed or super anxious or develop a substance abuse disorder or anything else. I forgot to mention sleep disorders real quick. That's another common one. Sleep disorders, trouble falling asleep, trouble staying asleep, insomnia, parasomnia, all these. and that ties in with the anxiety, ties in with the pain, ties in with the depression. It all goes hand in hand. But yeah, the sleep disorders are classified as mental illnesses. So they're definitely excessive daytime sleepiness, stuff like that is fairly common. But yeah, so there you go. There's some common mental illnesses seen in Behcet's, but like me personally, my teens and 20s were fucking awful. I everything I just talked about, I dealt with: the depression, the anxiety, the substance abuse, the suicidality, all of that stuff. But once I got into my 20s, I started figuring things out. I started taking better care of myself, eating right, exercise and stuff like that. I started doing all the things I need to do, which I'm going to talk about in the next video. I'm going to talk about Behcet's, and not mental illness, but Behcet's and mental health, and things that you can do to improve your mental health. And that will indirectly, almost definitely, in some ways, improve the course of your Behcet's by keeping your stress down and stuff like that. But we'll get into that in the next video. All right, thanks for watching. I'm Ellis Michaels. Be well.